Hey there, Dr. Rob Davidson here, Executive Director of the Committee to Protect Medicare. We're going to try to do a semi-regular medical or healthcare response to the coronavirus task force daily briefings and specifically to some of the claims and comments made by President Donald Trump that may be confusing to some people and certainly contradictory to some things you might be hearing from your governor or from other medical members of the task force or people you hear on TV or the things you read. So we wanted to provide a place where you can come and you can trust what we're saying from a medical perspective and how some of these policies are impacting our patients and might be impacting you. I'm going to try to do this with a guest as much as possible today. I'm really excited to be joined by Dr. Farhan Bhatti. He is a board-certified family practitioner in Lansing, Michigan, also the CEO of Carefree Medical, and he can tell you a little about that. He's also one of the founding members of the committee, of the board of directors of the Committee to Protect Medicare, so has been very active in the fight of this group to fight for affordable health care for all. So I'll let Dr. Bhatti take it away.
Well, thanks, Rob. Thank you for having me. It's my pleasure to be here. Like you mentioned, I am the CEO of Carefree Medical in Lansing. So what we do is we provide, high quality medical, dental, optometry, and behavioral health care to low-income folks in the Metro Lansing area. These are people who are underinsured or uninsured. They have Medicaid, or they maybe have a commercial insurance plan with a $10,000 deductible. So that's the world that I live in. And these folks are even more at risk of being impacted by the coronavirus because of their socioeconomic standing.
Awesome. Thanks for that work. So I guess we're just going to start out a little bit with kind of both of our general impression of the task force briefing today and just some other thoughts of the day and what's going on in this very strange world that we're living in now. For me, been talking about this for a while now, and I think we'll be talking about it for a long time, is the whole issue of testing. I'm not sure what your experience is with testing. I know for myself, working in the ER, I just worked last night in the ER, it's still the case now over 2.5 months from our first case in this country and on January 20th, that I cannot test every patient who I believe has COVID-19. My criteria are basically if you're over 65, if you have a certain list of comorbidities, if you're pregnant, if you're a healthcare worker, or if you're sick enough to get admitted to the hospital. So a significant number of people, a typical 40-year-old comes in with fever, cough, chills, and shortness of breath, but their vital signs are reasonable, their oxygen is reasonable. They would be discharged home, told they probably have it, told to isolate and not get a test, and yet be told that they likely have it. They would not be counted among the positives. So for the 500,000 cases in the United States, I think most estimates say you should multiply that by at least 5, maybe up to 10 to get the number of true cases in this country. I know that is true. Our hospital, at least 100 people in the last month in a small community hospital, rural hospital, at least 100 people have been sent home with a presumptive diagnosis and they don't make it on that list. I don't know if you have any thoughts of the day or what's been going on lately, how it relates to your practice.
Well, I absolutely agree. I mean, there are so many people that we want to test that we simply can't. And so we have to ration out the tests. I have not ordered the test on anybody that I think doesn't potentially need to be hospitalized. And so, if they've got mild flu-like symptoms, if they have a cough and a fever, there's no treatment. So what I do is I say, you probably have it. You've got to stay home for 2 weeks and you can't go to the store. You can't go out to buy food. You got to quarantine yourself and let your immune system fight it off. And if you do develop shortness of breath or high fever and you need help with your breathing, then you have to go into the hospital. And so the number of people that have this across Michigan and across America is much, much higher than the reported numbers. We just don't have enough tests to test everybody. And when we first did start testing people in the outpatient setting, those tests were taking 7 to 10 days to come back. So you had people that were in isolation almost for an entire 2 weeks before they even knew if their test was positive. So it's definitely a work in progress with respect to testing.
Right, and I will say in our area, and I think it's across the state, and these all come down from the CDC. Ultimately, these guidelines of who you can test, it's better than it was. Previously the age was not a factor. Previously it was third trimester pregnant women we could test. Now it's all pregnant women. And so it's actually moving in the right direction slowly. It's just, to me, remarkable that two and a half months later, we're still not there. And so maybe even getting into a big part of yesterday's briefing and today's briefing, where several reporters in the room were asking President Trump about testing. And I guess I want to get your impression. Now, we know that testing is lagging. We don't have enough testing, and a lot of people aren't being tested. But what are your thoughts on how testing should or will or should play in kind of how we progress in managing this crisis on a local level, state level, national level? And then we can kind of connect that to what President Trump has been saying.
Well, in science and in medicine, everything that we do, everything that we're supposed to do should be data driven. And right now our data is so flawed. And so what we need to do is beef up our data collection. We need to reach the level of sophistication that other countries have reached. Everybody keeps talking about South Korea because they're such a great example of a country that was able to test a very high percentage of their population in mass. And we've got to be able to move in that direction. And the president should make that a priority. And I'm afraid that they have not done that. The task force has simply not been up to the challenge when it comes to testing the general population to see how many people are asymptomatic carriers and are going to potentially pass it on to people with weakened immune systems and the elderly, et cetera. And so until we really have a better understanding of how many of us are actually carrying this and not knowing it, we run the risk of potentially going back to work too soon. The president wants to restart the economy. All of us want to be able to live the lives we were living before this happened. And nobody's cheering for anything bad to happen. But the reality is, if we go back to work too soon, we might lose all the progress we've made. And we might take a bunch of asymptomatic people, expose them to each other, and then spread this thing all over again. And then you'll start to see that rate exponentially increase, over and over. And so I am concerned that until we have better data on which to make decisions, that we don't act in haste and that we don't open up the economy too soon and expose a bunch of people and then overrun the hospitals. Already here in Southeast Michigan, the hospitals are full to capacity and they're having to make extra beds. And that problem will be compounded if more people contract the disease too soon. And that's exactly what would happen if we go back to work.
Okay, and so you said something about data, and I think that's... and I think data is critical. Now, President Trump has said we're testing more than anywhere else in the world, right? He said we've done more tests than any other country in the world. So if we believe the numbers, it's like maybe 2.5 million or more tests to this point. Maybe you can explain to people watching why just a raw number of tests doesn't really tell the whole story.
Well, yes, we've done more numerical tests than any other country, but there's 350 million of us here in America. And so we've still tested a very small percentage of the total population, whereas in South Korea, they've tested a large percentage of the population. So the data that they're producing and the models that they're using to project, peaks and et cetera, is much more accurate and reliable. So yes, it's true that we've done more tests, but the percentage of tests that we've done for the population is still lagging way behind.
Right, and I think that's key. I think, when you want to paint something in a positive light, and I see this in studies all the time, talking about relative risk reduction of the disease, that goes from, 0.5% to 0.4%, and you say, wow, that's a decrease of 20%. It's like, no, it's a decrease of 0.1%, And now he's saying, well, we've done more tests than anybody. It's like, well, yeah, but we're, relative to the other countries, we're much more populous. I think Germany is number one. A couple other European countries, I think we're somewhere around number 7 or 8 on that list, below South Korea, below Singapore, below Germany. And, again, we're heading in the right direction. I just feel like if they would just tell us the truth and tell us what their plan is next, we'd be in a lot better place. Now, he was also asked today, well, how are you going to open up this economy? if you don't do testing? And his answer was, well, we'll do it when the cases are in retreat. And when he was asked, well, how do you know they're in retreat without testing? He said, well, they won't go to the hospital. People won't be sick. I mean, does that jive with what you're seeing in your clinic? I know I can tell you my experience in the ER, but from what you're seeing in the clinic, does just getting sick, going to the hospital equate to who's actually sick, who has the virus?
No, of course not. It's a laughable proposition for the president to think that he can just trust his gut on this one. Um, the number of people that we're seeing in clinic that probably are carrying it is pretty high, but we don't have the capacity to test them. So, we're taking universal precautions and doing our best to keep ourselves and our patients safe. But we know that there's the risk that they're going to go and spread it to their families, or, spread it to somebody while they're waiting in line at the grocery store or waiting in line to pick up their food. And so it's just so unfortunate that the president is always sort of seeming to put political calculations ahead of what the reality needs to be in order for us to come through this across the finish line with as few deaths as possible.
Yeah, I mean, that's exactly, that's what I'm seeing. We're seeing people who come in who are sick, but not sick enough to be admitted. And then so many people, I know my wife is a family doctor and she does a phone screening for the state of Michigan. And I believe the last time she did it, she said 10% of the people who she talked to, who she was pretty sure had the disease, or at least had the symptoms consistent with the disease, only 10% qualify for testing. So there was, 80% of people who probably have it are told to go home and isolate, but will never get counted. And they certainly wouldn't be part of a calculation on how to open things up if you're just basing it on who goes to the hospital. The other thing that's been talked about a lot lately, and I think there's a lot of misinformation, and I think for me, I would love you to see what you think, and we can hopefully help together clear this up for folks. It's the models that are out there, right? So there's these statistical models that have tried to and continue to try to predict how many people might die from COVID-19. And I think famously last week, President Trump talked about, or maybe it was earlier this week, that they were predicting 2 million deaths at some point, and at that point he said they were down to 100,000 to 240,000 possible deaths, and if we could keep it to 100,000, he would consider that they did a great job. And now the models are predicting even lower numbers, 50, 60,000 people. And I see some people on Twitter, and I see the president even talking about it. How can we trust these models if they're all over the place, and if they're saying it's really that low, doesn't it mean it's time to start opening up because we've done such a great job? I guess, what are your thoughts on the model? And then the fact that these models are showing lower numbers, does that mean we're done, we're good, and we fixed the problem, back to work, or what does that mean?
Well, so of course we don't live in a static world. We don't live in a world that's standing still. The world is ever evolving, and our response to this disease is also ever evolving. And as we do a better job as humans of combating this disease, then we can change through our actions what those models show. And we can change the number of people that become sick and die from this disease. And so we should be congratulated as a public. The people of Michigan are doing a really, really good job, and the people across the country are doing a really good job of staying at home by and large, following the orders of 6 feet apart and good hygiene and all the rest, all the changes that public health experts have been imploring people to engage in. Those things are working. And as a result of those initiatives, we are seeing a decline in the number of deaths that were predicted, and that should be celebrated. However, if we stop too soon, then we're going to lose that progress, and we're going to unfortunately see even more people die than need to from this disease. So, what Dr. Fauci and others are doing is making decisions based on the best data available. We've already mentioned that data is not the most robust data that it could be, or not as robust as it could be. But they are using the data they have to predict or to study what's the doubling rate. We hear a lot about the doubling rate, and early on the cases in New York were doubling every 2 days. And so obviously from a public health perspective, you want to see that doubling rate start to slow down to every 3, 4, 5 days. And eventually you want to see it start to level off and then plateau and then turn around. So, but our interventions have a very large hand in what the data actually is going to turn out to be.
Yeah, I mean, I couldn't agree more. And I think Dr. Fauci said very early on, and I think it's a tough part of managing these kind of crises because the general lay public doesn't think about this every day. Even physicians don't think about it every day. But we have training and looking at data and statistics and kind of those kind of models. And he said, listen, at the end of all this, if people look and say, why did we do all that? It wasn't nearly as bad as you said it was going to be. He said, well, then we've done a good job. And so it's tough because it's hard to take credit for deaths that don't happen that you initially predicted, because of the interventions that you employed. I agree. Staying home is like the number one thing, right? Social, I call it physical distancing. Physical distancing is the absolute number one thing that most people can be doing. A, to decrease the number of cases, decrease the number of deaths, and B, to prevent our hospitals from becoming overwhelmed like they have become in parts of New York and parts of Southeast Michigan. We just want to avoid that happening in Lansing or West Michigan where I am or anywhere else. Now, here in Michigan, our Speaker of the Michigan State House, Lee Chatfield, took to Twitter to criticize our governor. Gretchen Whitmer yesterday extended her stay home, stay safe order, essentially a shelter-in-place order for the state of Michigan through the end of April. And even I think said, hey, this may not be done then, but it was extended because the State House and Senate only extended her emergency powers to that point. And Lee Chatfield was criticizing her about this. He seems to think, listen, this is too much. People need to get back to work. I guess what does this say to you on kind of leadership from the very top, President Trump and his words, and how that may be filtering down into folks like Speaker Chatfield and his very public criticism and rebuke of the governor?
That's exactly right. So what it says to me is that things that the president has been saying for the past several months, even things that he's tried to unsay, those things have very much filtered through the psyche of people, of our friends across the aisle. And so, when Trump was busy in January and February trying to minimize the risk or trying to tell Americans that it was no big deal, those talking points seeped into the talking points of all the Republican leaders up and down Congress and governors across the state and state legislators across the state. And even as President Trump has started to take this more seriously, some of his allies across the state, Governor DeSantis in Florida as an example, some of his allies have been slow to come around with the idea that this is something that we need to take more seriously. And, Mr. Chatfield is no different. It is seen from their perspective, it is in their party's best political interest to get the economy moving again and to minimize to their constituents the effects that this could potentially have, the grave effects that this could potentially have on public health. So it's very unfortunate that from my perspective, politics are continuing to come into play here when they don't need to be. We need to all be on the same team, moving in the same direction, because that's how we're going to be able to get back to the lives that we were living before this pandemic started.
Absolutely. A couple more things. One, we talked about this before, and it's been talked about a lot, but I guess general thoughts on drugs like hydroxychloroquine, azithromycin, zinc, perhaps others, even some antiretrovirals, and then kind of the danger of our president and others using their bully pulpit or their megaphone touting these therapies, and your general thoughts on that.
This has been a huge frustration of mine. I mean, I would love for there to be a treatment that comes out to fix this problem. Everybody wants a quick fix, but in medicine, we're always weighing the risks of something versus the benefits of something. And hydroxychloroquine does have risks associated with its use, number one. Number two, there are people who are legitimately in need of that medication. And if we start to just prescribe it to everybody that might have coronavirus, and people with lupus and people with rheumatoid arthritis are going to be able to get access to a necessary medication that they need to live and for them to have a good quality of life. So what are some of the risk factors of hydroxychloroquine? So cardiac toxicity is a big one, where you're looking at what we call cardiomyopathy, or it can cause an enlarged heart in simple English. It can also cause QT prolongation, or heart arrhythmias, an abnormal heart rhythm. It can cause bone marrow failure. It can cause angioedema, allergic reactions, hives, irreversible eye damage. It can cause what we call retinopathy. So these are some of the big side effects that are well known in the studies. And you don't want to expose the general population to those side effects just because. You want to have good data that shows that there's actually some tangible benefit from taking that medication, certainly more than just anecdotal data. So I'm encouraged that places like Henry Ford are doing the clinical trials. And, I hope those clinical trials show efficacy. And that would be great for people that are in ICUs and that are fighting for their lives. But until we have that data, it is really irresponsible for President Trump or for anybody else to just be pushing this unproven treatment on the general population and potentially exposing people to harm.
Yeah, could not agree more. We're going to try to wrap it up in a few minutes, but there's one last piece I wanted to touch on. I think a lot of it would connect to the work that you do every day with Carefree Medical, certainly the work I do in an emergency department in a poor rural community. We're seeing massive job losses, right? We're going to see huge numbers of people in Michigan, across the country, losing employer-sponsored insurance. And while the Affordable Care Act does have a special 60-day enrollment period for people who lose jobs, you said it before, some of your patients have employer-sponsored insurance or private insurance with huge deductibles, $10,000 sometimes, even less than that, $2,500, which is routine, which is well beyond the means of so many, especially your newly unemployed. I guess, what are your thoughts on, that's a big question for a few minutes, but how this crisis is impacting those folks, the folks that you see, and then, how maybe this has shined a light on this problem. And, I have my thoughts on how we can see our way out of it, even in the short term, with the next round of stimulus, perhaps. But anything you can think of, briefly on that.
I think one of the things that has happened as a result of the pandemic is that it has brought to light the idea that everybody needs to have access to healthcare. And what we're seeing in the polling is that Democrats, independents, and Republicans, all a plurality of us, understand that there's not just a moral imperative for everybody to have healthcare, but there's an economic imperative that businesses do better when their employees are productive, when they're not missing time. And so the coronavirus has brought this front and center, the idea that we do need to have a better healthcare delivery mechanism than what we have right now. I'm concerned on the part of my patients because what I'm seeing most commonly in the clinic is a worsening of anxiety and depression. And depression and generalized anxiety and schizophrenia, but even people who didn't have mental illness before, now they're suffering from depression and anxiety because we're all human and we're worried about the world around us. And when you're worried about not just your health and your family's health, but you're worried about what's going to happen if I get this disease and I'm hospitalized and I can't afford the bill, none of us should have to have that worry of the financial burden that we might incur if we get hit with this illness or any kind of illness. And so this has really brought that to light.
Yeah, and I know for myself, and I'm sure you have this experience, this has been happening in this country for at least 4 decades on a daily basis. It's just happening in a very slow fashion such that it doesn't grab headlines all that often. But this is happening in such a hyperacute state of the crisis. My thoughts are, in 2014, we had expansion of Medicaid in Michigan and I believe 38 other states. Bringing a few more people up to 138% of the federal poverty line under the Medicaid system, and it was funded by the federal government at 100%. I think it's down to 90% funding, still significantly higher than the 68% funding in Michigan right now. And my thoughts are, hey, we have an existing system that works. The expansion worked. It worked for healthcare. It worked economically. States that expanded saw a huge economic boom of people being healthier, being able to now go to work. Why can't we have some version of expansion of Medicaid funded through the federal government rather than just sending people checks thinking that's going to allow them to pay their health care? Get them the healthcare they need so they can manage chronic diseases, be less at risk from COVID-19, and also help mitigate any costs associated with COVID-19 and the anxiety and stress that comes with not knowing where you're going to get that coverage or who's going to pay for it if you get sick. Does that seem like, at least in the framework, a reasonable thought?
Absolutely. I mean, most of my patients at Carefree went the majority of their adult lives without having health insurance. And so they've got all the same diseases as the general public, but they're much more advanced. So their diabetes is worse, their blood pressure is worse, their obesity is worse, their mental health conditions are worse. And so they are at the most risk if they get coronavirus from having a bad outcome.
Right.
And then when you add to that the idea that they might suffer immense financial hardship, it just makes it that much more concerning and stressful or stress-provoking for the people who I serve every day.
Absolutely, absolutely. Well, I think I could hang out and talk for another 20 minutes easy, but people watching may be getting wary, and we certainly don't want to go longer than the president in our remarks here. But I've learned a lot from you. I appreciate that. I always do whenever we talk. I hope the people watching have learned. Again, for folks watching here, this was recorded and we're putting on Facebook. We're trying to work out the technology to live stream this to Facebook Live, and hopefully we can work that out for the next installment. We don't have plans specifically for a schedule, but we're going to make this a semi-regular, if not regular, hopefully daily or nearly daily type of discussion. I think it's important throughout this crisis, and really from the standpoint of the Committee to Protect Medicare. Probably we need this every day or on most days, even when there isn't a pandemic looming affecting our lives, because the plight of folks in this country when it comes to healthcare, lack of healthcare, unaffordable healthcare is, again, it's been a decades-long crisis. It's why we're in this fight. Hopefully it's why you're in it with us. And we'll keep coming to you to the extent that we can, bringing you the truth and bringing you our perspective on what's going on in the world. So Dr. Bhatti, thanks again. Try to stay safe, and to everyone watching, please stay home, stay safe, wash your hands. That's the most you can do to help all of us survive this, to help us in the healthcare field maintain ourselves as well. So thanks.
Thank you.